Hey everybody, I'm Dr. John Willardson. And so I get a lot of patients who will ask me, why is it that smoking is so detrimental? Well, let's take a look at some photos because, we truly do see the effects of smoking in our patients' mouths. And it's actually in their mouth that it's manifested first. And so let's take a look at this photo here, and you can see all of the buildup and the debris and everything that's collecting on this patient's teeth. And the smoking, the carbon monoxide, basically it binds oxygen. So when that oxygen is bound to create carbon dioxide, it limits the amount of oxygen in the mouth. And so it really affects, like, the healing is very much affected by the fact that the patient is smoking. So let's say, for example, I was to, extract a patient's teeth, do some grafting, place some implants, suture, and then the patient smokes same day or the day after. All of that surgical area, the wound healing, is going to be delayed dramatically because the oxygen is limited in the area. Not to mention the nicotine and then the smoke, the dry mouth, everything that follows with it can truly affect and have a detrimental effect on the efforts that we're trying to make to restore their mouth back to normal natural function, giving them their smile back. So smoking can truly have a detrimental effect. And so when I see photos like this of the patient's mouth due to smoking, my mind always goes to, I can't imagine what it looks like in their lungs and other areas of their body where it's also affecting that we can't see. We can physically see this, but there are other areas that are affected as greatly. But the mouth truly is kind of the gateway to kind of visualizing where the patient stands, and it gives us a good look into their overall health. And so smoking is very detrimental. We all know that. And some patients will say, well, I just cannot stop. I can't quit smoking. It's just too, it's too hard. I've been doing it since I was a kid or whatever. And so there is a smoking cessation protocol, but in my practice, I'm very adamant about my patients trying to recover from lots of different things. And usually when they've lost their teeth and we have now restored their mouths and they have their smile back, they're confident again, they can eat, they can chew. A lot of times the smoking goes away with it because I'm very adamant about no smoking, especially those initial phases post-operatively or after surgery. And not to mention just the way the smells, there's a lot of benefits to stopping smoking. And so, I just want to kind of go over the fact that smoking, it's out there and a lot of people are doing it, and but we do know that it's detrimental, and we as doctors and surgeons and dentists, we can truly see these detrimental effects, and we see it firsthand. And so I'm Dr. Willardson. Thanks for watching.